just, do you want to give me a little update on who you are, what you're doing, where you're based? Just tell me about who you are.
Sure. So my name is Meital Bendet. I'm a PsyD candidate at the Wright Institute in Berkeley, California. I had my graduate studies before in Tel Aviv University for clinical psychology, and I'm currently an intern in Mount Sinai, Beth, Israel.
Great, thank you. And how have you got to know SEPI? And yes.
So the first SEPI meeting that I attended was in New York, and I was just following my dissertation advisor, Hannah Levinson, who was giving the pre-conference workshop on clinical supervision. And I knew I want to be present for her presentation. And when I saw the plan for the meeting, I was so excited. I was just seeing all those other topics and lectures and discussions that I wanted to attend. So it felt very, very exciting to get a chance to be there.
That's really great. And how would you say has SEPI influenced you? What have you gained and found and learned? And what is the most meaningful to you about your membership with SEPI?
I think that for me, as someone who's been trained in Israel and then in California and currently in New York, I've always got a sense that my advisors had a specialty in a specific domain. And I felt this implicit expectation that I will shape my, professional identity in a way that will be, either CBT or psychodynamic. And it never quite fit. And I remember when I saw the meeting calendar for the SEPI meeting, I just saw all those topics that really cut across different orientations. And it's a totally different way of thinking that's really resonated with me. And meeting, like-minded people in the meeting and just kind of getting to learn about a different way, an integrative way of thinking and conceptualizing that doesn't ask of me to give up, on just, I like some aspects of CBT. I can enjoy doing that work, and I love doing, relational work, and I enjoy research, and I enjoy practice. And it felt like this is the place where I can try to integrate the different parts of my identity and then become the therapist that I want to be.
That's really great. Completely agree, actually. And that's why SEPI is really great. And
it's so unique, it's so unique, and it's so crazy in a sense that it took me so long to find this place where there are so many voices coming together.
mm-hmm. And just to follow that up, and how do you think has SEPI influenced your career?
I think it's too soon to tell, at this point. I think at this time, it just made me feel validated, where, the way I see myself and the therapist I want to be, it feels like there is a place for people that are thinking, in this way and have this aspiration to look into the integration of different approaches. And I really hope to find myself involved more in SEPI in the future. I know they recently started a SEPI Israel branch, so I'm very excited to hopefully find myself into working with other people in SEPI.
That's really great. And I think networking and having that network in different countries and with all the new different regional networks, I think this is a very, very positive thing SEPI provides as well, to have the general international SEPI and then the regional network where you provide an opportunity and the possibility to transport this information and this aim or this perspective on psychology and psychotherapy also into specific countries, and then integrate also the different perspectives from the regional networks back into the international level. And I think that is a really, really great opportunity. And yeah, looking forward to see you in all those situations as well.
Thank you.
And then can you tell us a little bit about your project that you presented in the poster in just a few sentences?
All right, so the goal behind the poster was to analyze expert supervisors' interventions in session. I'm really interested in just observing experts' work, and there was this incredible database that Hannah Levinson, my advisor, and Arpana were creating for the APA supervision series. So I just watched them and tried to kind of come up with a system to characterize behaviors. So the idea was to look cross orientations because most studies, I think, focus on how supervisors, supervise for CBT cases or psychodynamic cases. So really try to look across orientations and styles and find those common factors, those things that all supervisors do, and found quite interesting findings about how to think about giving positive and negative feedback to supervisees, which is a challenge I think for all supervisors. Kind of the range between supporting and challenging, and also some other observations that we made in terms of what interventions happen more at the beginning of the session versus the end. So really try to analyze the observable data with this tool that we created, which we call the supervisory intervention scale, SIS, observer measure.
Great. So looking at the therapist variables and therapist side of psychotherapy, that is a very good thing. And I think that is probably one way on how we can increase efficiency and efficacy in psychotherapy, because we have tried on so many other levels to increase the efficacy of psychotherapy, but it wasn't possible. But probably when we start taking the most important mechanism, the therapist himself, and try to manipulate or start understanding at least what is happening and then increasing their abilities, then probably we're going to find an opportunity to develop psychotherapy to the next level.
Exactly. And when you identify the mechanism, then you can train psychotherapists to be more effective in supervision, in training programs, which is another thing I'm very interested in thinking, how can we help? Because the path to become a psychotherapist is so many years, right? And at the end, you think really, what are the things, that formative experiences in supervision that help me become a better, more effective therapist? And I think by identifying those ingredients, like you're saying, those mechanisms, we can also choose how to direct our attention in training programs and supervision.
Completely agree. Really happy that you're studying that intensively, and very much looking forward to the additional results you're going to produce and publish. Can't wait to see you, hopefully in the next SEPI conference in Lausanne, or whenever we have the next opportunity to meet again in person or digitally.
I look forward to that meeting. It sounds so interesting.
Yes. And then just the last question, what do you see as the future of psychotherapy integration?
I felt this is a question for more experienced people than myself. But from the way I see it, I think that there is that most people will agree that the therapeutic relationship is one of the common factors, the most important ones. And I feel like we still don't quite understand how to promote a better alliance, how to really identify when our patients are, kind of withdrawing from us or not feeling satisfied with treatment. And for me, as someone still in training, I wish to see in the future more trainings on addressing the therapeutic alliance, not just kind of naming it as a common factor, but really being able to identify ways to work with it more effectively. And there are so many things going into this, when to focus on the emotion, when to be more supportive, all of those decisions that we make, that we can kind of monitor how the patient responds to us. I feel like this is such a skill that takes probably decades to develop. And I wish that with this awareness, psychotherapy integration will help us create better trainings for that purpose.
Mhm. So in this highly complex procedure, or highly complex therapeutic mechanisms we are using, it's so diligent when we decide when to do what and whether we are really in accordance with the needs of the patient, or when we actually contrary to what he thinks he needs, but we actually think he needs that at that moment, and finding the right points for decision making processes, and learning how to do that. I completely agree that this is something very, very important. Yeah, great. And then my final question, can you just tell us a fun fact about you?
So the fun fact about me is that I have a crazy fear of heights, but it didn't stop me from skydiving several years ago, which is, I'm never going to do that again, but I did check my, fear of heights.
Great. Thanks a lot. Do you want to add something to what I asked you, or anything you would like to say in addition?
I guess I'm still grieving a little bit the loss of the meeting because of COVID, and I'm just looking forward so much to seeing everyone and participating in the next meeting, hopefully without masks, but who knows, with or without.
Yes, I completely agree. I'm really missing that as well, and hopefully Lausanne is gonna work out normally, or at least almost normal. Yes. So then I stop the recording. Just check, where's my button? Yeah, there we go.